your esophagus into your stomach, and from there your food eventually makes its way to your small intestine, where most of the nutrients get reabsorbed. It actually gets to your large intestine, which is what we call the colon. It's about 1.5 feet and it's long. And as your food makes its way through the colon, most of the water gets reabsorbed and your stool begins to form. And so when it's time for you to go to the toilet, you get the urge, you defecate, and then that is it. So your colon refers to your large intestine. And the function really is to absorb water and help to process your feces as it passes through. That is what the colon is.
Okay, so we all expect that the colon should work well, given all of the parameters also, in place. But why is it that sometimes things go wrong?
Yes. So with the colon, the most serious thing that can happen, of course, is colon cancer, which is what we are discussing today. Now, colon cancer essentially refers to abnormal cell growth in the part of the colon that eventually progresses and can lead to cancer. And in terms of why this can happen, there are risk factors, of course, for colon cancer development. There are risk factors that we cannot modify. So, for example, family history. If you have a family history of colon cancer, your risk is increased. If you have a family history of, and there are different kinds of family histories that are important. There are some hereditary colorectal cancer syndromes as well that can increase your risk, and that has to do with your genetics. But there are also factors that we can modify, and so things like obesity, things like drinking heavily in terms of your alcohol